Hello guys, hope you all are doing good. Today we are going to discuss about other psychiatric topic that is PTSD or post-traumatic stress disorder. Post-traumatic disorder is one of the most prevalent psychiatric disorder, but it is not noticing in proper way. So in this video we will see what is PTSD and what are all the etiological factors or risk factors of PTSD and how we can manage PTSD. What is PTSD means? It is an anxiety disorder characterized by stressful, distressing events, isolation, feeling of loneliness, irritability, and feeling of guilt. So there are a lot of symptoms we can see in the case of PTSD patient. And the symptoms will vary from severe to persistent, or simply I will tell you the symptoms will vary from person to person. And according to the survey, PTSD is estimated to affect about 1 in every 3 people. So if you take 3 people, compulsory for 1 person have PTSD. Then, while coming to the etiological factors, there is no proper etiological factors we can see behind PTSD, but we can see lot of risk factors which contribute PTSD. Among that, first thing is life-threatening situations. Life-threatening situation means anything which threaten your life. Might be an accident, might be some illness, might be some kind of severe life-terminating disorders, might be some personal problem, might be a crisis, might be a natural calamity, might be some personal injuries to you, might be some sexual assault or childhood traumas, neglects, violence, etc. etc. So based on the severity of the risk factors, the severity of PTSD also will increase. So there is no proper etiological factors, but all these risk factors will or may leads to PTSD. So life-threatening situations, any accidents, sexual assaults, physical abuse, neglects, chronic health problems, childbirth experiences, natural disasters, and military combat. These are all some of the risk factors which can create PTSD in a person. Well, coming to the signs and symptoms, first thing is always they will get a feeling of trauma or incidents in their mind, and they have always that fear that something is going to happen to them. Then always they will be in a disturbed thought, and disturbed images will come to their mind always. And when they sleep, they'll not get proper sleep. Always they will complain about nightmares and bad dreams. Intense distress, a close distress always they will feel. Pain means any part of the body they will complain about pain, but when we go to a medical evaluation and all, we cannot find the specific reason or any etiological factor behind this pain. Then sweating, nausea, tremor, these are all the common signs and symptoms which we can see in PTSD patients. Then another thing is hypervigilance. This kind of people will always show a hypervigilance nature, and that alertness feeling and panicking when reminded trauma, and that create hypervigilance nature. So always they have a feeling like something is going to happen to them, and if something is happening to others also, they'll get that feeling of anxiety, they'll get that feeling of distress, and it create a hypervigilance nature in their attitudes and activities, and this hypervigilance could create difficulties and disturbances in the daily day-to-day activities of the person. And apart from that, the person will show insomnia because of this distress, difficulties, and disturbed thinking. They cannot sleep properly, and they will not get proper hungry also. Then another thing is aggressive behavior. They will show aggressive behavior. We will feel that while seeing their aggressive behavior, they are purposefully, intentionally showing this aggressive behavior. No, nothing like that. To overcome their tension, to overcome their anxiety, to escape from the particular situation, okay, they will show aggressive behavior. Then inability to concentrate. They cannot concentrate in anything properly. They cannot concentrate means they cannot concentrate. That's it. Then always the PTSD patient will try to get busy with some things because they will always try to avoid their painful feeling. To avoid this painful feeling, they will try to keep themselves busy. Then they will try to forget the memories which create tension, and always they have a emotional and physical numbness. No feelings will be there. Then self-destructive nature. Self-destructive nature means self-harm. They will harm themselves. They will use some knives or some kind of blades to cut their bodies, and they won't show in front of others. It will be inside the body, like covering, when the dress will get covered, no, in that areas they will cut their bodies. Okay, self-destructive nature. Then they will eat more tablets to get sleep, and also this self-harm nature, why they are doing is to avoid their painful experiences. Then they will get addicted to alcohol and substance abuse. This is the very common thing which we can see in PTSD people. If the patient is coming with substance abuse addiction into a hospital, definitely the doctor or the psychiatrist will go back and check their history whether they have any PTSD experience or not. And getting addicted to alcohol or substance abuse is another major symptom or situation we can see in PTSD patient. And why they are doing this means through this they will try to avoid their painful feeling, and at last sometimes there are chances of suicidal ideation, because they will get severe depression. To avoid this depression, to overcome the depression, or depression may lead to suicidal ideation also. Then another type of PTSD, that is complex post-traumatic stress disorder. Complex, it is same like PTSD only, but the symptoms may not develop until some years after the incident happened. Okay, you met with an accident, that was a severe accident, okay, very heavy, hectic, horrible accident, okay, and you lost your loved one in that accident. Okay, in that moment or for some days or for some years, you will not show any symptoms, or you will not show any problems. But after some years, your body will react back, your mind will react back, you cannot able to concentrate anything. Okay, you will feel isolated, you will feel humiliated, you will feel that intense distress, disabilities, insomnia, anorexia, etc. So that is known as complex post-traumatic stress disorder. This is same like PTSD only, but the symptoms may not develop until some years after the incident happened. There is no specific years like 3 years, 4 years, nothing like that, but some years, after some years the symptoms will start to produce, or the symptoms will start to reflect in the activities of the person, and the symptoms will be more severe and more complicated comparing to regular PTSD. Then while coming to the diagnosis, or while coming to the diagnostic evaluation, major things are history collection, physical examination, and mental status examination. Through physical examination, history collection, and mental status examination, the psychiatrist or the mental health professional can understand everything from the patient, and based on that they will start the treatment. The symptoms will vary from person to person, so the treatment also vary from person to person. Okay, and before going to do this assessment, they will do a self-assessment first, like physical needs, mental needs, and social needs. 3 things will assess. After that only we'll go for detailed physical examination, history collection, and mental status examination. And this is about the diagnostic procedures which we are using for PTSD. Then while coming to PTSD in women, there are some specific symptoms we can see. According to APA, that is American Psychiatric Association, there are some specific symptoms we can see in PTSD in women. They are anxiety, depression, emotional numbness, and sensitive nature. So these are all some specific symptoms we can see in patient, especially in women with PTSD, and they will carry the symptom along with them for a long time, around 4 years. Though they are affected with PTSD also, it won't be visible. Okay, others cannot notice they have PTSD. They will carry the symptoms along with them, the anxiety, the depression, the sensitive nature, that emotional numbness, etc. So around 4 years they can carry like this. Okay, after that they need treatment, and they will definitely consult a doctor. While coming to the management, the first thing is medical management, but we will go for medical management at last. In medical management, mainly we are focusing on antidepressants. Antidepressants drugs are using to reduce the depression, but the psychiatrist will first check the condition of the patient, whether they can cope up without medication or not. For that they will give different kinds of therapies, different kinds of psychological programs and psychological support, etc. And the particular patient is not getting any result from the particular treatment, then they will suggest this antidepressants. Well, coming to therapies. The first thing is cognitive behavioral therapy. Cognitive behavioral therapy is using to change the negative thought into positive thought. The therapist will use different kinds of techniques to change the maladaptive behavior into adaptive behavior, and they will use different kinds of techniques to create a strong, consistent, positive thinking in the person. Okay, so there are different techniques we will use, and these techniques are really useful, and these techniques will help the patient to change their negative thought and isolation behavior into positive thought. Okay, and I will post the link of cognitive behavioral therapy techniques in the description box. Please read it, listen it properly, then you can understand how the cognitive behavioral therapy will work and how it will be useful to change the maladaptive behavior into adaptive behavior. What is the goal of this cognitive behavioral therapy? Means the goal is to maintain a self-confidence or to gain a self-confidence, as well as to reduce the escape and avoidance behavior, because PTSD patients will always try to avoid some situations which create anxiety, and they will try to escape from everything. But through the cognitive behavior therapy, they will try to the therapist will try to expose the patient to the situation which create anxiety. So automatically the patient will get an intimation like this is anxiety situation, and the patient will get habituated with that anxiety situation, and they will try to adjust with the situation. Then, while coming to the prevention, support is a major thing. Support is the only thing which we can do here. Support means like a hug, love, like a love and affection, love, empathy, sympathy. In which are all the way you can give support, give the support to your loved one. Those who are affected with the PTSD, definitely they can definitely we can reduce the severity of stress, and we can prevent the entry of PTSD into that patient. Then family support, family in the sense who are all there along with the patient. Family can do a lot. If family knows about the situation, might be family also undergone the same feeling, same situation, so they know what happened in what moment and how and which are all the things will help the patient to improve the situation, improve the mental status, and in which are all the situation will helps to reduce the stress. So family is playing a major role to support the patient to prevent the entry of PTSD symptoms into the mind of the patient. Then avoid the use of alcohol and drugs. That is very, very important. Most of the people go behind alcohol and drugs to escape from the symptoms and from the loneliness, anxiety, etc., etc. But if you use, you will get more addiction to alcohol and substances, and that will create again lot of psychiatric problem. Meditations, yoga, and exercises also will be very useful, and that will also helps to create a healthy body as well as healthy mind, and also will helps to prevent the stress and developing into PTSD. So this is about PTSD. Hope you understand. So PTSD means post-traumatic stress disorder. After any trauma, stress is developing in your mind, means that is known as PTSD. Again, I'm telling you guys, the symptoms of PTSD varies from person to person. Some people will come out from the stress and tension. Some people cannot cope up with the stress and tension, and they will start to show show different PTSD symptoms. But we can prevent it. We can prevent and we can stop the entry of the symptoms into the patient if you are giving proper help, support, love, care, affection, warmth, etc. Hope you understand, guys. Thank you.